Right, episode number 3. I'm going to experiment again with an episode off of their page on YouTube. So here we go.
After she was home, I got postnatal depression. I rejected her. It was horrible. I just disowned her. I didn't want to know her. I knew that she was mine, but in my heart she was, but in my head she wasn't. It was like someone was telling me, it's not your baby. It does get me upset, because I wasn't there for her for the first few weeks. I never got that mum experience or nothing.
How many weeks you?
34 today, yeah.
34. Are you scared?
Nervous, yeah.
We, in the UK, I've said this already on these reaction videos, but, 250,000 women a year regard their birth experience as traumatic. I mean, that's data according to the Birth Trauma Association. So, this is really pertinent. A woman who in her last pregnancy effectively had postnatal depression. So let's see how this goes. I'm not that impressed that the first thing the midwife says is, "Are you scared?" Maybe not the best use of language, because our unconscious minds cannot process a negation. What that means effectively, if I say to you, "Don't think of a pink elephant," well, in order to not think of one, your unconscious mind has to produce an image of a pink elephant in order for you to negate it. So if she asks, "Are you scared?" right, this client has to check on the inside, even if it's happening at a deeply unconscious level. So not a great start for this midwife.
Tell me all about it. Why are you nervous?
Don't know. Don't know what I'm expecting this time.
Okay. Is your partner with you?
No, he's got nothing to do with it.
Oh.
When I found out I was pregnant, he just split up with me.
Oh, you will be fine, love.
I know.
Oh, well.
Sammy Jo, she doesn't need a man. She can deal with anything. She's strong.
Do you have a lot of support from your mum?
Yeah, I'll always have her. I'm with my mum 24/7. I go everywhere with her. And if I stay in, she stays in.
I wouldn't let her go into labour without me being there. Your mum's your best mate, isn't she?
I learnt loads off my mum. She's brought 5 kids up. So it's just me and my mum.
How you feel to be mum again?
It's exciting.
Like new mum? Okay. I will come back in a second.
Sammy Jo's got an attitude. Proper attitude. I wouldn't say she was naughty, she's just brassy.
Sometimes it is a battlefield in here.
Me and Sammy are really similar, like 2 peas in a pod. But we're like best mates.
It's at the bathing pool, yeah. I'd love a water bath.
You would?
Yeah.
So when you tell him that?
She doesn't want one now.
Again, it's going to be a lot of repetition, I think, in these videos. This woman's having a cardiotocograph now. Routine cardiotocograph should be a thing of the past, unless there's an indication for the woman to be having one. They certainly shouldn't be a routine part of our practice. Mention in the comments, does it happen routinely at your maternity hospital?
It's just me. You okay, lovely?
Yeah.
Make sure you're drinking plenty of water as well, only because your pulse is quite high. Okay?
Yeah.
Your pulse is quite high, so drink plenty of water. I don't know about that advice, but introducing a high pulse rate at this point, I'm just not sure of the value of it. Again, comment on that if you wanna.
To make their water, it's disgusting.
Oh my God. Where did I get it from? Hello, I'm Leanne. I'm going to be looking after you. So, Sammy, am I okay to have a little feel?
Yeah.
Sorry, my hands are freezing. Pop you on the monitor for a little bit. You've got a lovely bump, haven't you?
I'll pop you on the monitor for a little bit. What is the reason for this tracing? Why? Why are they doing it? I don't get it. Now, obviously, we haven't got the full history, so we don't know what her background is, what her medical history is, what her previous pregnancy was like. But I don't understand the routine use of this piece of equipment. I don't get it. And maybe you can help me. You know, intermittent auscultation should be enough. You know, I always used to say to the women in the clinic that I met that although I will listen to the baby's heartbeat for, pleasure or cosmetic reasons, if you like, so that they can hear it, the best measure of fetal health is being aware of the baby's pattern of movement. You know, it's changes in patterns of movement that a woman should be kind of taught or encouraged to understand that she is monitoring the baby's well-being from the inside. You know, the idea that listening to the baby's heart rate in an antenatal appointment is of any value is a mistake. And in fact, I think the NICE guidelines actually encourage us not to do it routinely. You know, we do it if a woman asks, but let's not fool ourselves into thinking that we are monitoring the baby's well-being when we do it, because we're not. The first question I would always ask a woman in the antenatal clinic is, have you been aware of the baby's movements? What have they been like? Have you noticed any changes? I mean, it is good that this midwife palpated the woman's abdomen before she put the cardiotachograph on, because sadly I've seen loads of people not do that. So this is good practice if there's a need for a CTG trace.
Have you had anything yet, pain relief-wise? Would you have some paracetamol and codeine? Because it does, I know it's nothing major, but it does take the edge off a little.
First of all, why is she mentioning pain relief at this point if the woman isn't asking? It's not something I would ever do. Again, because of the presuppositions that are involved in the language. The things that we presume in our language have to be processed by the person hearing them, consciously or unconsciously. So why is she mentioning pain relief? And why, in her next sentence, is she saying, I know it's not very good? I don't get it. It's a poor use of language. It's an unconscious use of language that isn't really facilitating or adding anything to the care of this woman.
A little bit. Have you thought about pain relief yet?
No, just gas and air.
Is that what you want, okay? Is that what you had with your other little one? What's your little girl called?
Sky.
Do you know, it's great to be exploring the woman's already, the woman's preferences or the woman's choices. You know, I've said before that the one born every minute program edits out consent moments, so we've got to assume that those consent moments are there. There's just the way that pain relief is being introduced and discussed. It's not the way that I would do it. Maybe it is the way that you would do it. I want to get a sense of what the couple and the woman want, what they've been thinking about. I want to pay a lot of attention to their birth preferences list or their birth plan. I want to pay attention to that, but I'm not going to be offering pain relief without being prompted. Maybe that's just me.
Oh, God, lovely name. You're doing well through these contractions.
I didn't feel none.
She did over the first, you know.
Did ya?
Yeah.
Best way to be, I was a screamer.
The first time I got pregnant, my labour only lasted 27 minutes. So all I felt was, and it was pressure with me
Loads of
first.
pressure, that's all she was getting over
And
sky.
tightenings and not pain or nothing.
Just felt it going tight, but
Yeah.
not as so much uncomfortable.
They popped me waters and then I was pushing for 7 minutes and then she was out. 3 pushes.
1 minute she was 3 centimetres and the next minute she was 10.
Oh, we'll keep an eye on you then.
Yeah. I says, you'll be ages, you're in 3 centimetres.
Carl, this raises some interesting thinking around perceptions of pain. Way back when I trained as a nurse, there was a piece of research done by a chap called midwifery. And the long and the short of it was, he said that pain is what the patient perceives it to be. You know, there's no place for us as clinicians to be making assumptions about the level of pain that a person is in. I don't know about you, but on the labour ward, I've heard midwives say things like they're making a meal of it, or, you know, it can't be that painful, or whatever. That's always inappropriate, right? Because pain is in the eye of the beholder, if you like. Pain is whatever the person who's experiencing it says it is. And over the years, I've noticed a consistent pattern. It's anecdotal, but it happens so often that I think it's worth mentioning. You know, when a woman would ring into the labour ward and I would be speaking to them, I'm listening clearly to what they're saying, but I'm waiting. I'm waiting for them to have an experience of a tightening. Because what I assume will happen is as the tightening begins to grow, the woman's speech pattern will change. You know, so she'll be talking and then suddenly she'll go, hold on. And I want to be aware, because it gives me a clue of the intensity of the woman's experience. You know, how she's, inverted commas, managing through these tightenings. But there have been a number of times over the 30 odd years where a woman will call in, she'll say the tightenings are coming regularly, you know, every 5 minutes or something something like that. And I'm waiting and waiting and waiting, and I'm not hearing any changes in breathing pattern. Now, before I realised this, my assumption would be, it can't be very intense. You know, she probably needs to stay at home a bit longer, all of that kind of stuff. But I learned that I needed to ask another question, and I would ask, have you been prescribed analgesics or pain relief for period pain? And almost invariably, if a woman said to me that she had been prescribed analgesics, you know, non-over-the-counter analgesics for period pain, that how that woman perceives the labour tightenings is very different. It's almost as if she's experiencing the tightenings of the muscle in the uterus, and she's saying to herself, this can't be labour, because she's comparing this experience with the discomfort or the intense pain that she has when she menstruates. And over the years, I've found that if I ask that question and the woman says, yes, I have been prescribed analgesics, I would often invite them to come in and find that they are well established in labour, 6-7 centimetres by the time they arrived at the labour ward. But as far as they were concerned, this couldn't have been labour. So it's an interesting discussion.
He says, and goes downstairs to have a ciggy, and our Gemma phone and said, Mum, you better get up now, she's pushing.
She didn't miss it.
No. I said, how can she be pushing?
Yeah,
She's only just been 3 centimetres. She went, Mum,
Wow,
she's pushing.
That is brilliant for
It's like that on the butter, trying to get in.
The first time round, because my labour was that quick, I didn't even know she was coming out to me. I was in shock.
She had the petadine in the leg at 8:30. She had the baby at 20 to 9.
Sorry about that. I'm stopping it a lot. Do tell me if this is irritating, me stopping it. This raises another crucial point. Answer me this question. What is the point of doing regular vaginal examinations every 4 hours? I think most places in the UK, that's the kind of regime the midwife is wanting to follow. What's the point of doing regular vaginal examinations when there are always going to be women who do not follow any pattern? You know, this woman here went from 3 centimeters to fully dilated within a very short period of time. You know, what is the point then of following these arbitrarily made up measurement type systems? You know, a woman should progress 0.5 centimeter an hour, blah blah blah. If they're a primip, if they're a multip, it should be 1 centimeter an hour at least. It's arbitrary, it's made up, and it's not necessary. And in my practice, the only reason to do a vaginal examination was if it was indicated for some reason or other. A lot of the examinations I did were because women were asking me to do them. And I think up and down the country, routine vaginal examinations are common and are happening everywhere when, in my view, they're not necessary.
Big breath in through your nose, loads of air in slowly out through your mouth. Just focus on that breathing till it's gone.
She didn't bond with the baby or do anything with the baby. There was no reaction from her.
After she was home, I got postnatal depression. I rejected her. It was horrible. I just disowned her. I didn't want to know her. I knew that she was mine, but in my heart she was, but in my head she wasn't. It was like someone was telling me, it's not your baby. It does get me upset, because I wasn't there for her for the first few weeks. I never got that mum experience or nothing.
You're doing so well. Keep breathing. Keep breathing, because if you stop breathing, you'll start feeling this pain more. I want you to just focus on your breathing through each one.
My mum stepped up and took over until I got myself together.
For 6 weeks, I had the baby.
It's a sad story, isn't it? And sadly, there are countless women out there suffering in this way who never receive any support whatsoever. So it's horrible. I do want to draw attention to the midwife getting down to have eye contact and gently supporting this woman with breathing. I mean, that's pretty cool, I think. It's pretty cool.
Big breaths, my lovely. Keep breathing. You're doing absolutely amazing.
After 6 weeks, I just thought, now, come on, you've got to shake yourself out of this. And we just put the baby on it and just left her. Let her get on with it. So she knew she had to do it then.
You're doing really well.
Deep breaths, Sammy Jam.
That's it. You can do this. You've done it once before. Nice and calm, lovely big breaths.
Go on, it won't be long now.
That's it. Just take each one as it comes and we'll all help you through it.
Lucky I had my mum. I'm grateful that she was tough. Otherwise I would never ever snapped out of it. But I wish I could turn back time and do it right.
You're doing amazing. Just keep going.
I'm pleased that worked for her, you know, being told to snap out of it. Not sure how that would work for a lot of people. But obviously her mum loves her probably more than anyone else in the world. So hearing that from your mum is probably okay, right?
I hope and praying that this time around I get to older and be a mum.
You're doing amazing. You're doing a little star tonight.
What number baby is this, Sammy Joe?
2.
Number 2.
Number 1, big less quick though.
Number 1 was less quick.
No,
it was more quick.
dead quick.
All
yeah.
right.
She went from 3 to 10 within 10 minutes.
All right, darling. Let me have a little look.
I've commented on this before, I think, but I despise this. You know, let me have a little look. You know, we haven't seen the consent moment. We don't know why she's doing a vaginal examination. Maybe it's just routine. We haven't got any details about that. Why is she doing it? I'm just having a look. She's heard about the history, a precipitate birth the last time. So let's see how she conducts herself. The midwife at the moment is not impressing me.
You're not ready yet, darling.
So don't push. You listening?
Nowhere near ready. Baby's head's quite...
You are nowhere near ready, darling. Oh, I just despise it. You know, it's like when a midwife does a vaginal examination and she or he will say, you're only 3 centimetres. I mean, this is just as poor. You're nowhere near ready. Baby's head is high. She's just heard about the history. You know, when I'm talking to a woman after a vaginal examination, I'm always starting off with, you know, you're in the birthing process. The birthing process has started. It starts really the moment a woman starts to feel tightenings. Yet we know that over a period of time, they're probably going to ebb and flow and go away. And then she wakes up and they're there again. You know, but the birthing process has started. I'm going to start with that. I mean, the other thing we've got here is a woman who we don't know, but she is probably comfortable on the bed. I don't know. But I learned early on in my practice to do a vaginal examination when they're required in any position the woman wants to be in. It takes some practice to learn how to do it, but you have to turn the landmarks of the head around in your mind if she's kneeling or standing or 1 foot on a chair. But as far as we can see here, this woman hasn't been given any kind of choice. She might have been. This midwife is not impressing me much.
Quite high up, okay?
Please push
You can't. If you push on that neck of the womb, it's going to end up swollen. You don't need...
So I don't know. Is there any evidence, real evidence for this? You know, the idea that a woman can be told not to push. You know, in my experience of being with women, the idea of not pushing when the urge is irreversible, it's just madness to suggest that a woman doesn't push. You know, it doesn't make any sense to me at all. Nor does the use of Valsalvas, you know, the chin on the chest, push into your bottom. You know, in my experience, when a woman is, you know, moving towards second stage and transition, is that there'll be an urge to bear down right at the end of the tightening. Most of the tightening, a woman will be breathing through, and then there's this guttural urge right at the end, which doesn't last that long. You know, Valsalvas has been discredited, but yeah, I'm sure we see it everywhere. And I would never, ever suggest that a woman not push if the urge is irresistible. It's ridiculous to say it, in my view. The other thing is that, you know, we're not seeing any exploration. We don't know why she's on the monitor, for a start, but we're not seeing any exploration of different positions, because there's positions that she could take up that would make it less likely that the urge would be present. But we're not hearing or seeing any of that, are we? And maybe it's editing.
Only about 2 centimetres at the minute. Are you coping all?
There we have it. You're only about 2 centimetres. Now she's going to say, are you coping with the pain? You know, she said, are you coping? Even the shift towards the use of, are you managing, or how are you managing at the moment? You know, this idea of coping, being at the edge of your ability to cope with what's currently going on.
All right with the gas, or do you want something a bit extra?
Do you want some morphine, Sammy Joe? It's not going to harm you.
Yeah.
Well, you'll need it. You're not going to be able to do it with just this.
Come God, it's all stacked up against her, isn't it? The presupposition you need it. You're not going to be able to do it with just this. Are you happy with the gas and air, or do you want more? You know, all these assumptions that other people around this woman know what she needs when she knows what she wants, right? You can hear it.
You won't.
And it's linked to her wanting to be with her child when the child's born. She doesn't want to be out of it.
He's laughing now.
The first time I got pregnant, I didn't feel my labour.
Shouldn't have to cry or laugh.
This time, I want it to last at least a couple of hours. I want to feel the pain. That's what I really want. This time around, it's like a second chance for me to start bonding with the baby and be a mum. Basically, it's like having a first child again.
What's the name going to be? India. India. Happy birthday, India. Oh, there's no waiting for you, was there?
I love that, the vernix on the baby, don't you? You know, that it's great. It suggests that she's, I don't know how many weeks she is, who knows. But this midwife who said she's going to be ages is now saying, you didn't hang around, did you? Well, if she'd have listened early on, she might have picked up on the information related to the first baby and stuff.
You all right?
Real. Real.
Of course it is.
It is amazing. It's just... I hope she has the same as what we've got, the bonding together.
She is. She's gorgeous, look at her.
Once you've had kids,
She's lovely, isn't she? Very lovely.
I've got to grow up. You can't act like a kid yourself. And I've got to be there for my kids. I want to be a carer mum, be there for them all the time. I've got to be tough for them. It's me and my kids against the world.
Hello. Hello. I have always wanted to have children young because my mum was young.
Right, well, I've had enough. I hope you're enjoying these. That's episode 3. Thank you very much.